All right, so we are on with this week's talk of Doc Talks, and we have the art of the toe touch.
And an art it is, you find folks who are tuning in today on Instagram Live.
It's not the easiest for a lot of people, I'd say. It's a sneaky, hard test, but everyone's like, yeah, touch your toes. It doesn't mean that much, but it does.
It does.
It definitely tells us a lot about the body, a lot of areas of the body, and we'll talk about what it means and how to assess it, what things we kind of look for, maybe some progressions on how to get better at it, and some key areas that we need to focus on to make it even more better. Even more better is not good. That's not good. Don't take that away from this.
More betterer, maybe.
More betterer.
Well, and also too, if you're someone who can't touch your toes, and we'll go into why you need to, what needs to happen, and how to do it. It's so gratifying when you go to the point where you can't touch them to finally touching them for the first time. And I'm sure you've had a lot of patients who it's like, oh, I've touched my toes, and it's a good skill that you should be able to do as a human being.
Yeah, it is, and I think when it becomes so limited, when you're barely able to move forward at all, and your toes seem like they're miles away, it's scary. You know, it can be scary for some patients because they're limited on what they can do. They end up moving like robots and kind of doing these things and stuff. So, you know, getting that skill back is important. So. Let's get right into it. Why is it important, Zach?
Well, the reason why a toe touch is important, Kyle, is because it's a great way to assess range of motion in multiple joints throughout the body, because it's not just tight hamstrings because you can't touch your toes, because there's a lot of other moving parts that have to happen. Sure, you have to be able to bend at your pelvis, but your spine has to be able to move in certain directions. You even need your head and neck to be able to move in certain directions. There's motion that needs to occur at your knees to allow you to have an effective toe touch. And it gives you a good appraisal of, generally, if the back side of your body has the ability to relax enough to allow you to touch your toes.
Yeah, and I think the main thing that most people see when pain's maybe not an issue and they're trying to reach down and touch their toes, and they always say, my hamstrings, right? That's almost, I mean, I'd say 85% of the people that can't touch their toes, they would say, it's my hamstrings. You know, back here gets tight. And like Zach was saying, there's so much other stuff that happens prior to your hamstrings getting tight, then that might just be the first place that starts screaming at you to say, stop, I can't go any further.
Yeah, absolutely. And I even see that too with people who can palm the floor and they have really good flexibility, which that comes with some problems as well, stay tuned, where they think that they have tight hamstrings and they need to stretch more. So it's not always the fix.
Yeah, that's just the portion of our body that probably screams the loudest.
Yeah, absolutely, for a multitude of reasons.
Yeah, so looking at like what it means to be able to toe touch too, why is it important? You know, there's a lot of things that we have to do as human beings that require us to reach down towards the ground and be efficient. You know, doing this and going to pick something up compared to being able to reach down and pick it up. What's more efficient? What's a little bit maybe more functional is going to be the second one. We want to be able to do the second one. We don't want to feel like we have to, you know, stack our spine the entire time. I know. I'm sorry. Stacking is important. But, you know, we want to be able to have freedoms to be able to flex and move the spine. And that's one of our activities of daily living require us to be able to bend forward and move and pick up and do that stuff. And we just have to know that this toe touch assessment, or the ability to toe touch, gives us more opportunities to be functional.
Yeah, and one of the tenets of us at Elevate, one of the things that we strive to give everyone is physical freedom. So we want you to be able to pick up things off the ground in as many different ways as possible. And that's a good indicator from a health standpoint that you're not going to overload any specific areas, that your back is safe and healthy.
Yeah.
And if you have to do that stacked move, because I mean, we've both seen people that have had to do that, that's a problem. And we want to be able to have you do that as freely as possible.
Absolutely.
Another interesting thing about the toe touch is, believe it or not, folks,
This is interesting.
it is a quick and dirty assessment of your cardiovascular health. Who knew, right? There was an interesting study that was done in 2009 where they looked at different fitness measures to see who, possessing certain things is more at risk for cardiovascular disease versus not. If you are someone who has difficulty touching your toes, that has shown to have an association with increased heart disease risk. Now, that doesn't mean that your inability to touch your toes was the reason why you maybe have to take blood pressure meds. Or we can't also say that because you can't touch your toes and we get you to touch your toes that now you need to don't need to take blood pressure meds. But it is another indicator that we can look at that assesses health, not just isolated to the movement system, which is our bread and butter, but also beyond that as well.
Yeah. So someone that had poor cardiovascular health would have a poor toe touch potentially. Potentially,
Yeah.
right? So before we got on recording this, we were talking a little bit about why. There's a couple of thought processes that went through our mind on why. We didn't look too deep into the research and figure out exactly why this starts to limit, but coming from our thoughts and our clinical reasoning on why, if there's not enough maybe perfusion, which means the blood doesn't get out to certain areas, or it's very constrictive, that would make all the tissues around it maybe be constricted. So the muscles, the ligaments, the tendons and stuff that are around the cardiovascular system, meaning lungs and heart, if that stuff is suffering a little bit, it's gonna kind of clamp down a little bit. There's gonna be less health around that area. So then in turn, when we're looking at this, we'll look at the anatomical sequence, like what needs to happen and when it needs to happen in the body. But if we're starting to kind of reach down and this stuff feels like it's, unable to relax, then that might be a reason why that it shows also cardiovascular dysfunction.
Well, and then if you're in that situation, you still got to shoot blood out throughout your body. So your heart is going to push the blood harder through the vessels so you can get adequate blood flow to your tissues. And that's essentially what happens with high blood pressure.
Yeah. Is
the vessels constrict, they get smaller, the heart has to work harder to shunt blood into the tissues, and then problems ensue. And on the flip side of that is a lot of times, and this is anecdotally from my experience, so take that for what it's worth, but sometimes when I see people who are very flexible, someone who can palm the floor easy peasy, a lot of times they have difficult times with low blood pressure for the exact opposite reason. If they're too relaxed, they're too chill, well, now I can't create any pressure surrounding the blood vessels, so
it's like blowing air into like a big balloon. It's just floppy at that.
Yeah, exactly. And that has problems as well, because especially when you go to do something like exercise and you need to generate tension.
Yeah.
You might not be able to get your blood pressure up as high, so that could potentially limit force production. Also, too, if you're someone who struggles with dizziness when you stand up, which we call orthostatic hypotension, where you stand up and your blood pressure drops too fast. Well, it may be that you're not generating enough pressure when you stand up, enough tension in your muscles, which, Kyle and I are pretty good, especially with your 10,000 swings, and I might do 10,000 curls this month.
Oh, there we go.
Probably terribly.
You're already halfway through the month.
Yeah, we'll start today. But if you can't generate effective tension as well, that can also be problematic for a lot of reasons.
Limits where the blood goes, right? It limits how much you can get out to the extremities, out to the head. It's a decent amount of range of motion or distance from heart to head. So if that gets, you're blowing into a really, kind of, I always think of the guys on the side of the freeway, they're all loosey-goosey with those little air things going through. But if that's your vasculature, that might be the reason why. It's not,
your vasculature works very similar to those things.
Yes.
Interesting, I know. I mean, it's pretty cool. It's pretty fascinating.
All right, so we looked at a couple of reasons why. So we have it's a multi-joint assessment. It looks at hips, it looks at spine, looks at all these areas of the body, cardiovascular assessment potentially, and then an ADL or your activities of daily living assessment, giving yourself more potential movement throughout the day. So what needs to happen with a toe touch? I'm glad you guys asked, because we're going to go through each segment of the body and figure out what needs to happen.
All right. First, I would probably make sure you have some legs, but since we don't, that's okay, because a lot of this motion is happening at the spine.
Yes.
So if we just say in general what needs to happen is your body has to tip forward, and then your spine ideally should round so you can complete the toe touch.
Mm-hmm.
And a lot of times if you can't do that, either you'll see someone where they just get mostly rounding in the upper back and then they can't go all the way down. Or and this is someone who has really good flexibility, they might actually be able to keep their spine flat and then just tip the pelvis way down.
And reach, yeah. They'll be able to just end up reaching to the toes.
Yep. Neither of those are desirable because we want that good segmental flexibility, and we want all of this stuff back here. So your back muscles, the ligaments in the back, all of that needs to be able to stretch so you can safely go down without any problems.
Yeah, and it's funny you say this area, because I mean it's pretty typical when we see someone reach for a toe touch. The natural curvature.
I'm stuck in the pelvis.
Sorry. So natural curvature of our spine, we have like this a little bit of a slope to it, but this area is already predisposed into going into a little bit of flexion. So we're usually typically better at that than we are going the opposite way. And then same here, this stuff's already predisposed into going into a little bit of extension, holding those postures. So it might be a little bit uncomfortable for us to go forward. We just have to make sure that our movement variability, or our ability to move in a bunch of different ranges of motion, is as high as possible for this movement. So these things typically come easy going forward and having that concavity here, convexity here. That was right?
Depends on your perspective, yeah.
Concavity, convexity, yeah. So I think that's kind of the reason that we see these compensations into these areas. So I'll have you take that back. So we talked a little bit about spine being able to move forward, pelvis being able to dip forward.
You have to be able to dump forward.
Be able to dump forward. We can talk about
knees.
Need
to be able to stay straight too. Yeah, and that's one thing we couldn't show. So if you're someone with your toe touch and you have to do it this way, well, that's not really driving the mechanics that are needed at the pelvis to be able to get this portion to happen, which is the pelvis to tip forward. When you straighten your knees, that biases the mechanics at the hip joint differently, so it allows for your pelvis to dip forward.
And if we truly are looking at the entire back portion of a human, we want to assess the entire back portion of a human. Having a little bend in the knee, we kind of cut some of that stuff off. We're not really truly assessing some of that stuff now. Now we're just looking at maybe the spine and the hips, and then it kind of stops because it breaks the line. So we want to have the longest point from point A, like the back of the skull, to all the way down to the feet. We want to make that as long as possible to really truly assess everything there. So having a little bit of a bend in the knee, that can be a little bit of a limit to your assessment if you can't do that.
Yeah.
Or it can kind of magnify something that you might need to work on. So anatomic sequence: spine, hips need to dump forward, legs need to be able to be straight. We need to be able to be strong enough to hold ourselves as we go down, meaning we need to feel confident. There's a lot of people that once they hurt themselves by moving forward, they become pretty scared of that movement. I know that you've had those people. I hurt myself picking up an ice chest off of the ground, and now whenever they do that, they're like, I don't think I should do that because it's really scary. So every time they bend and move forward, they have that same kind of trigger in their head, and they're like, well, I don't want to do that ever again because that hurt.
Yeah, and that's something we want to discourage you from doing, because at some point in time in your life, you're going to have to bend forward. And if your body isn't adapted to that specific movement, well, then it could potentially be more problematic and lead to a lot more pain. It's just like if, let's say you were a runner and you lay off running for a year, and then you decide, you know what, the sun is shining, the birds are chirping,
it's not
the COVID particles seem like they're dispersing to other places. I'm going to go for a run, and you go to your mileage that you're doing before. Well, you're probably going to not have a good time because your body hasn't adapted to that stimulus. It's become deconditioned.
Yeah.
And something can happen with as simple as a toe touch as well.
Yeah, I mean, you always hear about the people that, I was picking up a pencil and my back went out, or my back went out, you know. And those people, you know, if you look in their history, they typically have like irritation, and it finally gets this massive pain symptom, and then they become, you know, their tissues become really inflamed. They have to go through the whole process. But if they were to condition themselves correctly on how to move forward without creating pain, then they might have a different outcome. You know, that pencil
100%.
wouldn't be, you know, so detrimental to their back health. So fear avoidance is, we need to make sure that we overcome fear avoidance. And then looking at another approach, or things that need to happen, we talked about musculature, we talked about bones, ligaments, tendons. Something that is pretty important also, there's this little thing that goes right through the spinal column. Our cord, that needs to be able to move, and we have nerves that come off of the cord, and it goes into even our arms and to our legs. That stuff needs to be pliable. So if we look at reaching down and being able to touch our toes, not only am I going musculature, am I going ligaments, tendons, bone positioning, all that stuff, but my cord needs to be able to move within the casing that it's in. So we'll look at maybe a couple of approaches to loosen some of that stuff up, or at least get it to start sliding and gliding a little bit better, because that's huge. I do a lot of that stuff with patients post injury, because I want that stuff to feel like it can slide and glide in its environment that it's in.
Absolutely. Yeah, your nerves move just like any other part of your body, and nerves are meant to slide, they're meant to glide, they're meant to pinch.
Yeah.
They're meant to stretch, they're meant to do all of the things that any other body part of yours should be able to do. Yeah. And it's especially important in the toe touch. And it's also, too, and we'll kind of talk about troubleshooting through this, is if you're someone who feels tension in your hamstrings as you're going into a toe touch, sometimes if your nerves in your legs or even in the spinal column is a bit more sensitive, and then you try to push that by stretching, sometimes that could potentially increase symptoms and discomfort.
Oh, yeah.
And so that's why a lot of times we may not be stretching people's hamstrings to get a toe touch, instead using the type of approach that Dr. Booth was talking about, which is teaching the nerves within your body and all the tissues really to slide, glide, and move easy and effortlessly, so we can get some changes.
Yeah. So without further ado, we will move into the section of trying to get we'll go spine to move, we'll get our pelvis to move, we'll talk about some nerve sliding that could be a good approach, and then we'll finally talk about maybe some progressions. After you feel like you've gotten those things moving pretty well, then coordination is pretty important. We want to be able to just kind of coordinate those things together, so we'll talk about toe touch progression. So first up, let's look at spine. You know, just getting the spine to flex and move forward. What do you got? What's a go-to? It's smoke session time. Let's.
You know what? I'm going to take it easy on you today, Kyle, because I got a move that I like. The first one that we'll do is what I affectionately call rock back breathing. Let me just make sure IG is ready for this one. Perfect. Okay, so an easy one. Remember, goal number one is I need to be able to get the spine, this bad boy, to round over. So any position that I choose that gets that roundedness uniformly through the spine is going to be money. So what I'm going to have my main man Kyle do, this is the nicest you've heard it here, folks. This is the nicest I have ever been with exercise selection. Kyle, don't pull it up because I got one for you later. What I want a man to do is go ahead and get on your forearms and knees just like so.
Facing this way.
Yep. And
toes tucked, toes...
go toes untucked, actually.
Toes untucked.
And what Kyle's going to do is he's going to sit his rear back on his heels. And I want this part to be relaxed. And so you can see we're getting some nice roundedness here through his lower back. I want you to slowly, Kyle, go ahead and push your upper back into my hand without crunching here. So I don't want this to happen, because that's the issue that we had with the forward bend with someone who can't bend forward.
They would just do it through there,
segment.
yeah.
So I want a nice slow push up this way. And then another piece that I want is I'm going to tip the head a little bit up like this. So sometimes you'll see people when they do their toe touch, they create a double chin. And what that does, as Kyle was talking about, is it places a little bit more tension on the spinal cord, and that could be a limiter for motion. So we want to make sure that you're undouble chinned. Once Kyle's in that position, of course, you know what I'm going to have to do. I want my man to breathe in through the nose silently. Exhale, reach. And if you do it right, you're going to see, or you might even feel, air and expansion, stretching the entire backside. So I'll just have people hang out there to start. Hands will be flat, please. Push up a little more. And just breathe like your favorite Faith Hill song.
Jeez.
Cool. 3 rounds, 5 breaths. That's where I start most people.
Very good.
How about yourself?
So similar, but if we want to look at maybe even a little bit more of a progression into this, we can get into going onto hands and knees, and then we can go into a little bit more inverted, getting into positions here. So you can push air down to the belly button as you're getting into this, and you round as opposed to getting into a very, very straight line. So most people are used to doing stuff that's like this, and it looks like a teepee. I'm okay with just pushing up into a position here and getting nice and round, and then inflating as much as I possibly can. Because now gravity's pushing down on us a little bit more. The arc of the movement, more body parts are involved. And we're starting to look a little bit more close to that standing toe touch variation. So getting into onto the feet, onto the hands as much as possible, starting to raise the feet, the knees up off the ground, and then taking that big, just like you said, expansive breath, so that you feel all of this stuff, feel like it's almost decompressing a little bit. Because what we spoke about in the very beginning, being able to elongate the tissues in the back, we can push from the inside out, correct? Mm-hmm. I mean, the breath actually pushes from the inside out and allows these tissues to start feeling a stretch from the inside out. So as you're taking those breaths, that's what you want to feel. You want to feel those big, expansive breaths as much as possible to really stretch some of those musculature and ligaments, tendons, all that stuff through there. Yeah. Be careful with that one. Like I said, it is a progression. I think the stuff that Zach showed in the very beginning would be a very good one to start with.
Yeah, I would say, like, if that's good, go to this.
Yeah, then you'd go into this. Why? Because when we start raising the hips up, extending the knees, locking some of those things out, we have more tension in the system, more and more tension in the system, more neurologic tissues are getting more stretched. So it's just a little bit more threatening sometimes if you're not at that progression yet. So start slow. Be very, very comfortable with that stuff and slowly progress into maybe that next section.
And an easy way with any of this to see if that was a good move for you or if that was probably too much too soon is after you've done it, recheck your toe touch.
Yeah.
If it's better, that was probably a good move, and milk that until you don't get those changes.
Yeah.
If you did that move and you come up and your toe touch is worse, well, then it may have been too much. And that doesn't mean that you never do that again.
Yeah.
But maybe you start with rock back and you go a little bit longer with that, and then you come back, and then maybe the next time you do that, your body's a bit more adapted to that position, and your toe touch might be better.
Absolutely.
And that's something, it's the issue of too much too soon or too advanced too soon.
Yeah. Yeah, good play there. I mean, that's maybe two easy progressions for the spine. We're looking at we'll look at the pelvis next. So pelvis rocking, and I know you're already grinning. So I know it's about to get hot.
Let's get it. So as we mentioned before, pelvic-wise, this has to be able to dump forward to some degree. So there's certain positions that we can encourage that will reinforce that dumping forward. One of my favorites would be having the hips and knees at 90 degrees to start. So,
which way? On my back?
On your back. Go ahead and put your feet on the chair. Make sure you're still in line with IG. You most certainly are. And what I'm going to have Kyle do, now you might be thinking I'm going to have Kyle tuck here, and this doesn't look like the pelvis is dumping forward, but the mechanics at this range of hip motion are very similar to a forward dump. In fact, when you do touch your toes, you're at the same angle as he is here. So what Kyle's going to do is he's going to bring his knees in a little bit so everything is in a straight line. And Kyle, what I want you to think about is pulling your tailbone towards your heels and lifting your hips up. If you get it right, without kicking in the abs from all them swings, you're going to feel a little bit of hamstring. Okay? You can do the same breathing that I had you do on the other move. Start here. If you want to kick it up a notch, what I'm going to have Kyle do is he's going to straighten one of his knees, doesn't matter which side. And now basically I'm building the toe touch. You can see he's essentially doing a single leg toe touch if you were to look upside down. And then I would just have Kyle breathe in that position. And yep, actually, I'm glad you did that. I want you to reach with this hand right here. There's $10 million on your big toe. You can try and get it without moving your leg. And so you can do a nice curl up like that. If that's too challenging, because especially if you're someone who bends a lot in the upper back to try to get your toe touch, you might just keep your head flat on the ground and just try to reach that way. But I do a move like this all the time, and it's a really good technique to get a toe touch.
Yeah, that's great.
I'm going to do that on both sides.
That's great. So good for getting your pelvic mechanics to be closer to toe touch.
Yep.
So we talked a little bit about the addition of maybe like some sliding and gliding in nerves. We'll talk about that next. And then we'll get into our toe touch. So when we want to do this kind of easy, let's do it off of this chair here. Just give me a little bit of space. So when we talk about the cord, imagine the cord as a big rubber band on the back side of my body that goes from the base of my skull all the way down my spine, comes off into two sections and goes down the back portion of my leg all the way to the back of my foot. So if that's the case, if I did this, I'm going to be stretching that rubber band. We're going to be stretching all that stuff all the way down to my toe. Now if I point the toe, that actually loosens that rubber band. If I bend the knee, that also loosens. So we look at a couple of joints that can move. We'll look at the head too. So if I drop the head back, my cord or my rubber band gets looser and it gets more floppy back here. As I turn my head down, that rubber band gets tight. So we need to play with those. We need to understand what we're doing and how to move the cord and the nerves sequentially. So if I want to pull that rubber band down towards my feet, or I want to pull the cord and the nerves down towards my feet, sitting tall, sitting comfortable, and then as I go out with my foot extended and my toes coming back, I let my head drop back so that the nerves slide down. And then I do the opposite. I relax here and I drop my head, so essentially pulling the cord back up. So if we do that sequentially and we don't do it the opposite, if I do this and this, that probably is going to be painful right off the bat if that's a sensitive structure. We're going to have a lot. We could have a lot of pain if we do this. That's actually an orthopedic test that we do to see if that stuff is really sensitive. So we want to get that sequence right. Foot goes up, head goes up. Foot goes down, head goes down. And we're sliding back and forth. If you're doing this correct, you probably won't feel a ton. Where you're just getting that stuff to slide and glide, that would be ideal if you don't feel anything painful, big stretch, anything like that. So that's called a nerve slide or a nerve glide for your sciatic nerve. But just know that that's something that could potentially help that nerve feel more comfortable moving in its sheath.
Yep. And you're doing a lot of the same mechanics that your nerves need to do for a toe touch.
Yep.
Now,
just making it a little bit easier, right?
Yeah.
For progressing back.
Yep. That's exactly right. Now, will you ever progress someone to that?
Good question. So when we talk about going head down and foot up, that's the thing that I said not to do in the beginning. I said in the beginning because we might eventually get to a point where we're doing this, because that is essentially what a toe touch is, where our head is going to go down, our foot is going to kind of be in that what's called dorsiflex position. So maybe a progression later on. Yes, we want to make sure it's easy on the front end, and then we start teasing into that to where it feels like I can do this and this. Right now I don't have pain. Now, for some people that are sensitive, or their nerves are sensitive, that would be extremely painful for some.
Yeah.
And sure. I've had that before. I've definitely had nerve stuff before.
Yeah, it's not something, if you've never put yourself in that position, something that you want to push right from the get-go. But if you're someone who you're just trying to get that last little bit of toe touch, and you've tried all the other stuff, going into that direction where you're getting just that last little bit of tension, you're not holding it, you're just knocking on the door and then moving away from it, can be really good to get that last bit of motion.
Yeah, and we always try to think, 2 to 3s out of 10 in terms of pain or discomfort. That might be something you're able to use. If it goes higher than that, probably not something you want to use at that point. Maybe we need to figure out one of the other regressions first, or figure out something else to work on at that point. Yeah. So anything else on neurodynamic stuff? No. That's just a couple of brief things on those that could really help. And then we're looking at the coordination of a toe touch. We'll look at a couple of different ways to maybe start practicing that so that we can maybe get over a fear avoidance, or we can start working on our hips, being able to dump forward. We'll look at, do you want to do heels elevated first? What do you think?
Yeah, let's do that.
When we're looking at toe touch, this is the final test. This is being able to toe touch, legs locked out, going all the way to the toe touch. If we can't do that, we need to start taking away body parts or making things easier. This is a very common way to practice the toe touch.
So, as we talked about with our nerve portion.
Yes.
All right, this end range position is really tough, and it's a lot of tension in your system and can be problematic for someone. But if, let's say you did the slump slider that Kyle's doing, where you're kicking back, and you want to do something that coordinates a bit more into the full motion, this would be a good starting point. And so you want to either find an old man to make you a wooden block, like I did, or get a book that you don't like. Comment in the comments and let us know what it is, so we don't waste your time reading it if you do. And the reason why it has to be one you don't like is because you're going to step on it. You're going to put your heels on the book. And you're going to go through the mechanics that we discussed for a toe touch. So lock your knees, slowly roll forward, and you can hang out here.
Not bad.
Sometimes, yeah, it's pretty bad. But you can hang out here, breathe in this position. Sometimes what I'll have people do is on the inhale, they'll put weight on their outside heels and then have them go inside, and I'll just have them hang out there. I mean, I've also done just repeat up and down like this.
Yep.
Also, if you take a water bottle and you squeeze that, that also reinforces the hip and pelvic mechanics that you need to get down. You can see I immediately went a little lower.
Yeah, absolutely.
So just hanging out in this position, breathing, moving the ankles around, anything like that. Do you have any variations off of that one?
Yeah, so sometimes if we were doing this in a gym setting, we are in a rack, we could put a band from the top. We would push the band down to where we would actually actively have to push the band down. I don't know if you have do you have one in there? Oh, we do. Perfect. So if you can be my anchor.
Aren't I already?
So something that looks like this, you're going to have to pull on that pretty good. So if I do this and I'm pushing down, now I have to use the front side of my body to actually push down. That might make me a little bit more comfortable, a little bit more stable to get all the way down. Sorry if my heels were actually there.
No, sorry, go ahead.
So if we're
Thanks for the
here
workout.
and we're reach, go all the way down, that could be another help or another aid to get us all the way down there. So toe touch with block, heels elevated, takes some of the tension out of the posterior chain, allows us to get further and more coordinated down. Then we can look at taking away one side. So if one side feels maybe a little bit more tension, you're like, yeah, my left side just like won't allow me to go any further. We could bend that one a little bit. So bring the knee forward a little bit, and then we see if we can get all the way down. So if you started here and then you take that side away that's more tense and we get all the way down, now we figure out, okay, well, then we might need to work on something on the lower portion of your quarter to see if we can get more and more movement there.
Yeah. Yeah.
You use that often?
Yeah.
So taking sides away is a good thing for us. So anything else on progressions for our toe touch?
Your finish would then, if like you were trying to get just that last little bit, but kids, well, try this at home at your own risk. Please consult your physician before you do it. But if heels elevation makes it easier, toe elevation is going to make it way harder,
difficult,
a much bigger stretch. And you can go through a lot of the progressions that we did before. You can go down here, squeeze something, move the feet in and out, breathe in this position, anything like that, or even doing nice, slow, and controlled repeats can be really effective to get that last bit of toe touch. And that's usually my terminal. Yeah. You could even, with the single leg stuff that you could do, if like, say the double is still like way too challenging, well, you could do exactly what Kyle did, but instead of going here, well, now I can put my foot on the front
singles
and do a single that way,
yeah,
and you can get the similar effect.
Yeah.
So easy, heels, hard, toes, just right.
Just right. Flat.
And those are a lot of the ways that we would encourage someone to get that last bit of toe touch, put it all together.
All right, guys. That's I know we went a little bit long today, but a really important topic for us because it plays so much into functional movement. That's what we do here. We're trying to establish physical freedom, being able to pick up whatever you want off the ground, kids, 1,000 pounds, $10 million off my shoe, whatever it is. So if you need any help going through any of those progressions, if you have trouble reaching down towards your toes, you have pain reaching down towards your toes,
702-558-2151. You can book a free discovery session with either of us or with Dr. Wood. Give us a call. We can help you problem solve and troubleshoot through what you need to touch your toes effectively.
Yep. So be back next week. We're going to be talking, I believe, about creating time in your schedule for training with Francis.
Ooh, that's exciting. So if you're a parent, because Francis is parent times one, about to be times two.
Yeah.
But he's also one of the most ripped coaches that we got at Elevate. He still is able to find time and put in time to keep himself healthy. So you'll definitely want to tune in for that next week.
Absolutely. All right, guys. We'll see you then.
Adios.